Welcome to today's episode on Stay Medicated by Ifezo MD. And today we are going to be learning what to do for a drowning patient in order to save their lives. If you find a drowning person, there are two possible scenarios and what to do. First of all, you want to make sure that the person responds to you. If you know their name, you call their name. If the person does not respond or is an unresponsive patient at the time, you want to call for help. You want to call a hospital that you know that has an ambulance. If they do not, you want to find somebody around that can come with a vehicle in the Nigerian context to help take you to the hospital. What is the next thing you want to do? You want to confirm if this patient is breathing. And how do you confirm that? You want to come to the nose and see if the person is breathing. You hear with your ear if the person is breathing. And simultaneously, you are looking at their chest to see any chest movement. Another thing you can do for this patient is to check the carotid pulse. How do you check the carotid pulse? With your two fingers like this, you check the carotid pulse. If this patient has a pulse, like I said, this is scenario one. If the patient has a pulse and is breathing but shallow, what you can do is you help the patient, put them in this position, you raise their leg this way, and you turn them in this position for the water that is in their lungs to somehow drain out till help comes. That is scenario one. Scenario two, as usual, you want to start by asking, are you okay? Are you okay? Can you hear me? If the patient is unresponsive, of course, if you know their name, you want to call their name. Jennifer, are you okay? Victor, are you okay? If they are not responsive, the next thing you want to do is call for help. You want to call an ambulance, you want to call a hospital. In the Nigerian context, you want to find a bike, you want to find a taxi or a vehicle that will help convey this person to the hospital, not to a traditionalist, not to a church, straight to the hospital. So now that you have checked and see that the patient is not responding to you, the next thing you want to do is to assess their breathing. Is this patient breathing? How then do you assess if this patient is breathing? You want to put your ear, to the nose and look at the chest if there is a chest movement. If there is no chest movement and you cannot hear breathing, what do you want to do? Next, check for the carotid pulse with your two fingers like this, somewhere below the jawline. Press on it gently. If you see that there is no pulse, you don't feel a pulse, and you have not felt any breathing, the next thing to do is what? You stabilize the patient's neck for airway access. The next thing to do for this patient is what? 5 rescue breathing. In a drowning patient, the first thing you want to do after assessing the carotid pulse and checking for the airway is to give breathing. How do you give breathing? You want to give the patient 5 rescue breathing before CPR. So pinch the nose, open their mouth. Simultaneously, you are looking at the chest. So if you see the patient's chest is not moving and the patient is not responding to the 5 rescue breathing that you have just done, the next thing you want to do is to what? Perform CPR. And all of these things should be done very quick. Now, how do you perform CPR on a patient? Now, on your chest, in the middle line, if you go from the top here down, you would see that there is a depression somewhere at the middle line. It is called the Seifert process. So when you find this line with your fingers like this, you want to then place your palm just directly above that point. And then you put the other hand directly on it like this, in this manner, and you perform the CPR 30 times like this. And now when you're performing CPR, do not perform CPR with your hand doing like this. No, you perform CPR with your body and your arms stretched out like this. You lock your elbow and you perform CPR. And in the drowning patient, you just have to continue giving CPR. So there are two possible situations. Either you perform CPR till help comes, or you perform the CPR till the patient becomes responsive. You see the patient starts coughing. If the patients begin to cough, that is good news. So one thing you want to do for that patient immediately is to place them in this same position. You raise their leg like this, and you turn them this way for the water to drain out of their lungs until help comes. So this is what to do to help save the life of a drowning patient. I hope we have all been able to learn something today.